Dear student, myself Dr. Arvind Kumar Das, Assistant Professor, Department of Veterinary Medicine, Bihar Veterinary College, Patna. Today we will talk about the deficiency syndrome of selenium and vitamin E. Disease of selenium deficiency are the problem of worldwide. The biochemical role of selenium is observed as a component of the enzyme glutathione peroxidase. The enzyme from erythrocytes of both cattle and sheep contains 4 gram atoms of selenium per mole of the enzyme. On etiology point of view, selenium and vitamin E deficiency disease of farm animals are caused by the diet deficient in selenium. Excessive polyunsaturated fatty acids in the diet is a conditioning factors which aggravates the situations of selenium and vitamin E deficiency. Interaction between selenium and other trace minerals are also known as conditioning factors for selenium deficiency. Selenium and vitamin E supplementations can provide protection against covert-induced cardiomyopathy associated with diet low in selenium grown on selenium deficient soil. The pH of the soil affects the absorption by plant. Alkalinity encourages selenium absorptions by plants. Legume plants take less selenium as compared to the grasses. Seasonal conditions also influencing the selenium content of the pasture. Response therapy can be carried out to see the response of dietary supplementations of selenium and vitamin E. If the response of vitamin E and selenium supplementations are positive, it proves the selenium and vitamin E deficiency syndrome in herd. Heavy neonatal mortality indicates about the selenium and vitamin E deficiency. Unthriftiness in weaner calves, goats, and lambs are also suggestive of selenium and vitamin E deficiency. Chronic diarrhea in calves can cause selenium and vitamin E deficiency. Deficiency of selenium and vitamin E leads to infertility due to fetal resorptions in ewes. Dietetic hepatosis in swine is an also important syndrome of selenium and vitamin E deficiency. Now we will talk about the pathogenesis of selenium and vitamin E deficiency. Dietary selenium, sulfur containing amino acids, and vitamin E acts as synergistically to protect losses from oxidative damage. Both vitamin E and selenium deficiency in diet causes hyaline degenerations and calcifications of muscle fibers. Regenerations of skeletal muscle is rapidly followed by invasions of phagocytes and regeneration. In continuations of pathogenesis of selenium and vitamin E deficiency, vitamin E alpha tocopherol serves as a biological antioxidant. During normal cellular metabolism, highly reactive forms of free radicals O2 are produced. These include H2O2, hydroperoxides, lipoperoxides, superperoxides, and various hydroxyl radicals, and also single oxygens. Selenium is essential component of 5 selenoproteins, glutathione peroxidase enzyme, and deiodinase, especially in liver and kidney, converts T4 to T3 and selenoproteins. Anemia in swine is also caused by deficiency and affects the bone marrow. Nutritional muscular dystrophy occurs commonly in young calves, lambs, and foals. Vitamin E is active within the cell membranes as a lipid-soluble antioxidant, scavenging scavenging free radicals that otherwise might trace reacts with unsaturated fatty acids to form lipid hydroperoxides. PUFA contains high concentration of linoleic acids. Increased concentration of PUFA in the plasma enhances the chance of free radicals formations and tissue damage also. Animal may be at the greatly increased risk of tissue oxidative damage when exposed to vitamin E or selenium deficient diets. The myocardial and diaphragmatic form of the disease results in acute heart failure, respiratory distress, and rapid death in spite of the treatment. Acute muscular dystrophy results in liberations of myoglobin into the blood, resulting in myoglobinuria. Selenium and vitamin E deficiency in swine results in hepatic necrosis, degenerative myopathy of cardiac and skeletal muscles, edema, microangiopathy, and yellowish discolorations of the adipose tissue. Clinical signs and pathological changes in selenium deficiency deals with the muscular dystrophy. In acute injotic muscular dystrophy, affected animals die without premonitoring signs, especially after exercise. In nutritional muscular dystrophy, there are two types of cardiac form and skeletal forms of muscular dystrophy. In cardiac forms, has sudden onset and present with lesion in the heart, diaphragm, and intercostal muscles. Depressions, respiratory distress, dyspnea, nasal discharge, blood-stained pulmonary edema, profound weakness, recumbency, rapid and often irregular heartbeat is common feature. In cardiac forms, cardiac murmurs occasionally hurts on auscultations. Rectal temperatures may be normal, but may be elevated because of increased muscular works associated with respiratory efforts. Calves are depressed with dyspnea, tachycardia, and increased rectal temperature. Differential diagnosis should be done with pneumonia. Death within 24 hours can be possible despite of the medical therapy. Now, a skeletal form. This form of complications has slower onset characterized by the muscular weakness of or stiffness. Animals may be recumbent, unable to stand. Those that is able to rise on their own or with assistance shows muscular weakness. Trembling of limbs, muscles, or stiffness is a common feature. Supporting muscles of the fore and hind limbs become swollen, hard, and painful on palpation. Commonly affected muscles are gastrocnemius, semitendinous, semimembranous, biceps femoris, and muscles of the lumbar, gluteal, and neck regions. If diaphragm and intercostal muscles are affected, respiratory distress appears. Dysphagia occurs due to the involvement of tongue muscles. Often cardiomyopathy occurs. Heart rate may be increased, but heart sounds are normal. Animal with a skeletal nutritional muscular dystrophy often responded to the rest and treatment within 3 to 5 days. Animals can often stand and walk in these conditions. In calves, dullness and severe respiratory distress accompanied by prothy or blood-stained nasal discharge. Affected calves and foals are in lateral recumbency and unable to sit in sternal recumbency, even when assisted. Heart rates increased up to 150 to 200 per minute. Affected calves are thirsty and die within 6 to 12 hours after onset of these signs. Temperatures are normal in this condition. Subacute injutic muscular dystrophy appears in calves, also known as white muscle disease, and in young lambs, it is known as a stiff lamb disease. Affected animals remains in external recumbency. They are unable to stand. There are trembling of limbs, weakness, shoulder muscles and gluteal muscles are swollen bilaterally. Major involvement of diaphragm and intercostal muscles occurs in many cases and causes dyspnea and abdominal type of the respirations. Heart rate also increased. In severe case, upper border of the scapula protrude above the vertebral column and widely separated from the chest. This condition is known as flying scapula. In this condition, the toes are going to be spread. In false edema of the head and neck are common. The horses may be presented initially with clinical signs of colic. In clinical pathology, plasma creatinine phosphokinase in muscular dystrophy of calves, limbs, and poles is of diagnostic value. The SGOT activity is also an indication of muscles damage, but not as reliable as creatinine phosphokinase. Differential diagnosis can be possible with pneumonia, septicemia, and toxemia, and because they have posing similar presentation of sign. Mulberry heart disease, it is also another complications which occurs by the selenium and vitamin E deficiency. Deficiency of selenium and vitamin E occurs rapidly in growing feeder pigs. It also recorded in piglets and sows. Affected animals are commonly found dead without pre-monitoring signs. And the stress of the movement, inclement weather, or transportations will precipitate further as a acute death. The hepatosis diabetica and exudative diathesis is also another problem occurring during these situations. In both these conditions, most pigs are found dead. Before death, there may be dyspnea, depressions, vomition, staggering, diarrhea, and finally collapse may occur. Muscular dystrophy may be possible in these conditions, and also facial gastric ulcer causing ulcerations. Exudative diathesis occurs in chicks due to vitamin E deficiency. In other animals, retained fetal membranes may be due to the deficiency of selenium and vitamin E deficiency. Blood abnormalities like anemia, decreased PCB, and hemoglobin may be seen. Myoencephalopathy is a neurological defect, and degenerative myoencephalopathy occurs due to the selenium or vitamin E deficiency. Generalized steatitis are associated with vitamin E and selenium deficiency, and horses and recently windfalls are mostly susceptible for these abnormalities. Fat necrosis, yellow fat disease, polymyositis, and muscular dystrophy also occurs in other animals. In necropsy findings, bilateral symmetric myodegeneration is a consistent finding in nutritional muscular dystrophy. Skeletal muscles degeneration is characterized by pale discolorations and dry appearance of the affected muscles. White streaks in muscles bundles represents bands of coagulation necrosis, fibrosis, and calcifications. Cardiac muscles undergo changes similar to those of skeletal muscles. In calves, the left ventricle and septums are more frequently involved. Myocardial degeneration extends through full thickness of ventricular wall. A diagnosis can be possible by characteristic symptoms, by laboratory findings of CPK and SGOT. Diagnosis can be confirmed by analysis of glutathione peroxidase, estimation of selenium content in soil, feed samples, and animal lesions will indicate this selenium deficiency. Enzytic muscular dystrophy may be easily confused with other diseases when the myocardial or diaphragmatic involvement is severe. Dyspnea and with fever is difficult to distinguish from pneumonia. So differentiation is necessary between these two situations. Differentiation from the infectious diseases which cause septicemia, pneumonia, and toxemia is also necessary. In acute muscular dystrophy, the serum CPK and SGOT levels are moderately elevated. In lambs, differentiation from enzytic ataxia and swayback is necessary. Treatment can be done with supplementations of selenium and vitamin E. Supplementation of selenium and vitamin E depending on the species and type of productions. Supplementations may be accompanied in several ways like selenium fertilizations of soils, selenium top dressing of plants, additions of selenium in feeds, oral drenching of selenium and vitamin E preparations, selenium pellets, intramuscular injections. Combined mixture are also given. Combined mixture of selenium and alpha tocopherol is used in treatment. For muscular dystrophy in calves, lambs, and foals, mixture of 3 milligram selenium, especially sodium selenide, and 150 international unit per ml of DL alpha tocopherol acetate at the rate of 2 ml per 45 kg body weight intramuscular are recommended. In cardiac form, myocardial damage is extensive and incompatible with life in cardiac forms of the disease. Skeletal forms are amenable to treatment, but secondary complications due to respiratory diseases can be developed. Injectable selenium products are available with variable concentrations like 1 milligram to 5 milligram per ml of selenium with 50 milligrams of vitamin E are available. 0.055 to 0.065 milligram per kg of body weight. It can be revealed as 2.50 to 3 milligram per 45 kg body weight intramuscularly, or subcut injections can be given for the treatment of cardiac forms, skeletal forms of the vitamin E and selenium deficiency syndrome. Skeletal forms can be treated with oral alpha tocopherol, which is now available for all species and contains 500 international unit vitamin E per ml. The recommended dose of this product is 1 to 3 international unit per pounds body weight. Supportive therapy with antibiotics for secondary pneumonia and decubital lesions are given. Fluids and electrolytes are also supportive therapy. Properly prepared and stored hay grains with high quality green forage should be given to ensure adequate vitamin E intake. So thank you to all of you. We will meet on next class. Thank you.